So, good afternoon, everyone. Thank you for joining us again for this panel on reshaping the role of international organization in the post-pandemic era. I'm Federica Cristani from the Institute of International Relations in Prague, and I'm really delighted today to host four distinguished speakers that are joining me in this great panel. Before we start, I'd like to thank all the participants here and also all our participants online for joining us. I'd like to thank the organizers also this wonderful symposium, starting from Alica Itzekova for putting together this program, and also all the conference service team for this wonderful job, the Minister of Foreign Affairs for hosting us in this beautiful venue. And I'm now introducing our speakers. We have four speakers today, and one is joining us online. I'll start introducing them from Mr. Štěpán Pech, Director of the European Union Institutional Legal Support Department at the Office of Government of Czech Republic. Štěpán was the national coordinator of Czech policy for the withdrawal of the UK from the EU, and currently he's involved in the rule of law agenda of the European level, Article 7 procedures, the annual rule of law reports, the Council rule of law dialogue. He's involved in Foresight as a national Sherpa and in the Conference on the Future of Europe as coordinator for the civil service and current member of the plenary. I have also the pleasure to have Mr. Michal Broža, the head of the United Nations Information Center for the Czech Republic. Mr. Broja joined the UN in 1995 and has served in different positions since then, including peacekeeping mission in Africa and engagements in the former Yugoslavia and the Middle East. He specializes in issues related to the United Nations and communication on global risks and megatrends. He is a Charles University graduate in Prague and also studied at the University of Amsterdam. And we have the pleasure to have Professor Tamara Hervey, a Jean Monnet Professor of European Law, the City Law School, City University of London, Fellow of the Academy of Social Sciences, and Principal Fellow of the Higher Education Academy, and Honorary Fellow of the Faculty of Public Health. One of the first to the field, Professor Hervey has been researching all aspects of European health law since the 90s. He also publishes in comparative health law, in legal research methodologies, and in legal pedagogy. She's the author of 18 books and over 150 other publications. Professor Hervey works with a large network of academics across Europe and North America, and since 2016, she's also been working on the effects of Brexit on health. Professor Hervey has advised a range of European and national entities, including the European Parliament, the European Commission, the European Blood Alliance, the Joint ORIARCS Committee, hope I pronounce it correctly, of the Republic of Ireland, UK House of Commons Health and Social Care Committee, and the House of Lords EU Home Affairs Subcommittee. And joining us online, we have Dr. Pedro Villarreal, Senior Researcher Fellow at the Max Planck Institute for Comparative Public Law, International Law in Heidelberg, and leader of the International Interdisciplinary Project, International Health Governance. In this context, he has conducted research on international comparative law and human health issues, as well as its intersection with international economic law. Pedro received his PhD in law from the National Autonomous University of Mexico, and his book, Pandemics and Law, A Global Governance Perspective, published in 2019, was awarded the prize for the best doctoral dissertation in law and social sciences. So I'm very happy that we have all of them today to speak about the role of international organization post-pandemic era. Just before giving the floor, I'd like to briefly introduce this topic of this panel. We know that since the outbreak of the COVID pandemic, international organizations have been criticized for inefficiency or underperformance in dealing with the pandemic, especially the United Nations, its agency, the World Health Organization, and the European Union have been the target of criticism for having failed to provide a platform for states to coordinate their efforts towards the pandemic. Also, they have been criticized sometimes for having made the situation sometimes even worse, either by underestimating the risks or by preventing member states from taking adequate emergency measures. We can remember that in mid-April 2020, the US took the decision to suspend financial contribution to the World Health Organization. In mid-May, some NGOs blamed the UN Security Council for its inaction during the crisis. And in the same period, also European politicians like the former president of the Czech Republic blamed the European Union for its inactivity and also its inability to engage in coordinating actions. However, it's also true that especially since autumn 2020, these international organizations have partially succeeded in restoring their reputation, especially for the leading role in the global vaccination campaign and for having taken also the lead in promoting the idea of an international convention for addressing the response of the pandemic. In this panel, we'd like to address some questions. Especially like to explore whether these international organizations have truly failed, especially in the early stage of the pandemic, or they have become like scapegoats for national governments to blame them for their own faults. Also, whether the crisis has somehow unveiled some shortcomings in their inactivity or the modus operandi of this organization, and how should countries like the Czech Republic can react to these developments, and whether there is a need to revise the Czech foreign policy towards especially the United Nations, World Health Organization, and the European Union. So without further ado, giving now the floor to our speakers, starting from Mr. Štěpán Pech. Thanks again for being with us today.
Good afternoon, ladies and gentlemen. It is a pleasure to be here with you today, speaking on this topic, which is, of course, very pertinent and important at where we find ourselves now, several years following the initial outbreak of the COVID-19 pandemic. I would like to briefly speak on areas of my expertise, which is the national response of the Czech Republic and, of course, also the EU, stemming from my current occupation, which is the director of the EU Law and Institutional Support Department at the Government Office of the Czech Republic, which hosts the Section for European Affairs, which is the unit primarily dealing with EU policy in the Czech Republic. When we speak about reacting to crises and whether in the state departments, international organizations, the EU have responded fast enough, correctly, or adequately, we have to take a step back and realize the fact that crises, by their very nature, are not entirely predictable. All of the subjects which I have mentioned, of course, should have systems in place to deal with the expected and, of course, also in some way the unexpected. But the very nature of crises is that they come from a place where perhaps you did not necessarily anticipate them to begin with. That, of course, is then reflected in the initial response to any such crisis, in this case, the COVID-19 pandemic, where you do go through several stages. You go through stages of trying to find where you actually stand, what is actually happening, trying to see if you have means to combat the developments as they are ongoing, and then, of course, introducing new policies and new solutions to problems that perhaps previously were not on the agenda for you as a state or as an international organization. I think that we saw that reflected in the early months of the pandemic, not, of course, just in the EU, but also elsewhere. But I must say, from my experience, as time went on and as the full extent of the pandemic became known, as the full extent of what we can do to combat it became clear, I do believe that the state administrations and international organizations did step up to the plate and essentially came up with solutions and ideas where perhaps previously there were none or were not explored in such depth because, quite frankly, a worldwide pandemic in 2019, 2020, 2021 was perhaps not on anybody's mind a couple of years back. That does not, of course, mean that we must rest on our laurels. we, of course, do see further need to come up with solutions to anticipate more concretely and more directly, and that is also reflected in the EU's portfolio, which is the agenda of strategic foresight, which is aimed at ensuring that we will be able to more adequately predict such crises forming in the future and to have adequate responses to them ready when they do arise. And this all feeds, of course, into the legislative planning at the EU level as well. So to not take too much time in my opening remarks, I do believe, as a starting point, that while member states, other state administrations and international organizations perhaps did have a slow start in dealing with the pandemic, the final result as it stands now, or perhaps not final, but the current result, has shown that these institutions do have the means to react, although it may take more time than perhaps would have been adequate. Thank you.
Thank you so much. And now I'm passing the floor to Mr. Broža. Thanks a lot.
Good afternoon, and thank you for having me. It's a great pleasure, of course, for me to be on this panel and discuss such an important and an interesting issue like the reshaping the role of the international system, the multilateral institutions. As a UN staff, the United Nations staff, I'll speak rather from a global perspective. Let me start with saying that, common enemy is supposed to bring people, communities, countries together to, collaborate, to find a solution. In relation to COVID, the international community was not able really to come together and seek common solutions. There were many different strategies in many different countries all around the world. The independent panel for pandemic preparedness and response issued its report last May. It was headed by the former Liberian President Ellen Johnson Sirleaf and the former New Zealand Prime Minister Helen Clark. And for me, probably the most general but the most important takeaway is that the COVID-19 pandemic was a preventable disaster. The report highlights a list of reasons why and how the pandemics has evolved, and I will name only few which I find the most important. That the emergency declaration under the international health regulations were much too slow, and valuable time was lost at the very beginning. And after the public emergency of international concern was declared on 30 January 2020, there were too many countries which actually took the position, well, let's wait and see, rather than taking, strong, aggressive action to contain the evolving pandemics. Of course, at that time we didn't know, but we didn't stay on the safe side. So we rather took the risk, to say, well, all right, maybe it develops a good way. There was no coordinated global leadership during the first phase of the pandemics, and the global tensions between the superpowers undermined the multilateral institutions and the cooperative action. There was too little and too late international finance. Member states had underpowered the WHO, the World Health Organization, to do the job it demanded it to do, paradoxically. And let me also mention that in the first year of the pandemics, 17,000 of health workers died of COVID, which highlights also that there were not simply enough protection and enough support. If we recall the 2009 pandemics of influenza, the H1N1, There were at least 11 international high-level panels established and issued 16 reports with recommendations to improve global pandemic preparedness. Most of them were never implemented. The UN system, the United Nations system, responded to the pandemic in 3 major areas, 3 pillars, I would say. The health response, which was guided, of course, and led by the World Health Organization, and the strategic preparedness and response plan to control the virus, support the development of the vaccine, diagnostics and treatment, and strengthen preparedness, solidarity with developing countries, and special attention to people with special needs and greater risks. The second pillar was protecting lives and livelihoods. The UN was promoting policies to address the socio-economic, humanitarian, and human rights aspects of the crisis, issuing a number of policy briefs which were demanded by the countries, by the way. There were 16 different policy briefs: COVID and education, women, tourism, mental health, etc. The third pillar was recovery after the pandemics, with the aim not to go back where we were, but rather to open up to a better future, addressing issues like climate change and biodiversity loss and inequality, exclusion, etc. The Secretary General in March already called for global ceasefire. It was actually endorsed by 180 member countries of the United Nations, 20 armed movements, and more than 800 international civil society organizations. In April, he called to stop violence against women everywhere, including at homes. Again, it was well received by countries, and more than 140 countries actually contained included the issue in their national policy strategies to COVID response plans. My last point would be about the verified campaign, the awareness raising, and I would say the misinformation, disinformation issue to be solved, the infodemic as we call it, and to halt all the hate speech. The Secretary General was actually has been leading this awareness raising campaign. My very own department of global communications in New York is coordinating this communication strategy to actually base the information in the cyberspace on the science and on the verified information. I have to acknowledge here that my office did this, or has been in charge of this campaign in the Czech Republic, and we have been supported by the national institutions here, including the Ministry of Foreign Affairs and many civil society organizations. And I would like to look at the recommendations of the international panel at the second part of the discussion. Thank you.
Thanks so much. And I think we already have many food for thoughts. And now I'm passing the floor to Professor Hervey. Thank you so much.
Thank you very much, colleagues. Thank you for inviting me to be with you today for this very rich and informative conference. I'm really delighted to be with you. What I want to talk about is drawing from a piece of research which is a contribution to a comparative law project led by King's College London on the legal responses to COVID. It's called the COVID Lex Atlas, and it brings together a publicly available collection using a comparative law frame on all the different legal ways that countries across the world have responded to the COVID pandemic as a resource for us to learn from the future. And I was asked with my colleague Sabrina Rutger-Wirtz of the University of Maastricht to write the entry on the European Union and the European Union's legal responses to COVID. So what I'm going to talk about today draws on that piece of research, which is an exhaustive review of the hard and soft law the European Union's actions, decisions, instruments from the start of the pandemic, around about February 2020, until early July 2021, and I've been able to do a small amount of updating in preparation for today. So just to note that implicit in my research design is, of course, first of all, that the European Union is, at least in part, best understood as a rules-driven organization, and we've heard about that concept from some of our speakers already today. And second, implicit in my research design is that the law matters, and that's something that we might dispute. Certainly certain international relations experts don't think the law matters at all. It's politics is what matters. So I just want to note as a researcher that that assumption is implicit in my research design. So how has the European Union's legal response to COVID been? Well, the European Union's self-assessment, as you would probably expect, has been that the European Union has been fantastic in its response to COVID. Of course it has. I would say in a more measured tone that the European Union's response has been active, but assessing how effective it is rather more difficult. And so I would prefer to say that the European Union's response to the COVID-19 pandemic has been rather mixed. Undoubtedly, some of the reasons for that lie in a legal explanation. Undoubtedly, the European Union has been constrained, both formally by its limited legal competencies, and also in practice, as national governments responded individually rather than collectively, especially, as we've just heard, during the early stages of the pandemic. So I will, with your permission, Chair, divide my presentation into two parts, one where the European Union did less well, and then where the European Union did rather better. So where did the European Union do less well? First of all, the European Union did less well in the immediate crisis in February and March 2020. And I think this is very well accepted. I won't labour this point. The European Union's member states did not really use the European Union as a way to respond in the immediate crisis in early 2020. Although, even then, there was some effective EU-led action. For example, the European Union repatriated a number of European Union citizens from Wuhan very early on, and that was a collective action. The European Union organised a joint procurement of PPE in February 2020, and that was a collective action. But these were small responses in comparison to the nationally led responses that were mainly going on at the time. Secondly, the European Union did less well in the effects of its soft power concerning non-pharmaceutical measures. So non-pharmaceutical measures are the wide suite of public health measures that do not focus around pharmaceuticals or vaccines or treatments, medicines, but focus around public health behaviour. The European Union developed and shared many, many guidelines about almost every aspect of non-pharmaceutical responses to COVID. Everything from mask wearing to how should we celebrate Christmas and the winter celebrations. The roadmap towards lifting COVID-19 containment measures is a very good example. And the European Union's guidelines were based on measurable epidemiological criteria. So in that regard, the European Union did quite well. It followed the science, and it followed its scientists, and it followed the scientific capacity that it had developed over the decades in the run-up to the COVID-19 crisis. But as far as I can see, these guidelines have been pretty much all roundly ignored by the member states, and especially the larger member states. So we have to say that the European Union did less well in the effects of its soft power when it comes to non-pharmaceutical measures. Thirdly, and this is disappointing, the European Union did less well in exercising the powers that it does have within its hardcore competencies, especially in the context of free movement of people. So the European Union has significant power when it comes to free movement of people, both within the European Union and into the European Union, and especially into the Schengen zone. But actually, what happened was a completely uncoordinated closure of borders, both the EU external border and borders within the EU. And what we're having is a largely uncoordinated reopening of borders, both the EU external border and borders within the EU. And anyone who's traveled from outside the Schengen area to this conference today will know exactly what I'm talking about. So I myself saw, fortunately not me, but one of the people on my plane had a very, very long discussion with the border staff here, who clearly didn't know what to do with the fact that that person's paperwork was not the way that it was expected to look. So, that's just a very small human example. In general, the general point stands. So the European Union did less well in exercising powers which it does have around the free movement of people. Fourthly, the European Union did less well in instrumentalizing the power of its size and weight. So this is sometimes known as the Brussels effect, again has been referred to by some of the co-panelists in the other sessions today in this conference. But the European Union could have done better, for example, in negotiating vaccine purchase, especially in the early phases of availability of the vaccines. And again, I think that's fairly widely recognized and understood, although some people dispute whether that's actually the European Union's fault or responsibility, and whether perhaps I'm being a bit unfair in my criticism there. And then finally, the European Union did less well, I think, in relating the pandemic and its response to the pandemic to fundamental non-market values of the European Union. So the European Union did less well at thinking about how does the European Union's response to the pandemic relate to not how can we open up the market, keep channels of movement for essential products open, how can the European Union procure vaccines, how can the European Union license vaccines, and so on and so forth. But they did less well in terms of thinking about how the pandemic response relates to human rights protection or the equality agenda. Now, sure, there are multiple reports and so on, and in fact, my colleague just spoke about a similar situation in terms of the United Nations. There were multiple reports. The European Union Fundamental Rights Agency was very active in terms of articulating human rights issues and equality issues in terms of the pandemic and the European Union's response to the pandemic. But the kinds of deep integration of policy formation and policy instrumentation or implementation that would flow from the approach outlined in our keynote speech, if we had a European Union that was following the kind of deeply feminized approach to its policies, that was not present. So the European Union did less well, in my view, in relating the pandemic to equality and human rights agendas. So if I may, just for a moment, turn to where the European Union, I think, did do quite well. The European Union did quite well in terms of mobilizing its powers, especially or even where those powers are limited. So, for example, the European Union has used technical legislation, which is binding on its member states, to ensure European Union law is uniformly implemented and interpreted. And a really good example is the regulation on the technical specifications for the European Union's digital COVID certificate. So that is hard law, it is binding on the member states, and it means that everybody in the European Union can have a mutually recognized digital COVID vaccination passport. So the European Union did really well on that kind of technical level. The European Union also did really well in terms of building on existing legislative powers. And here, the key example is the Commission implementing decisions on authorization of COVID-19 vaccines in the European Union. So the European Union used the rolling review mechanism, which was already foreseen in the European Union's democratically legitimated legislation, to pursue the marketing authorization of the vaccines as they were being developed. And that the European Union did well. Secondly, the European Union did very well in collecting, collating, and disseminating information. And if I think back to when I first started studying the European Union's health law and policy, there was almost no mutually comparable health data at European Union level at that time. This is now 3 decades ago. So the European Union now does collect comparable health data across its member states. And that in and of itself is an important achievement, because if health data is not comparable, we cannot learn from it. We cannot think about best practice and disseminating learning, policy isomorphism, learning from good practice from the data. The European Union did well in coordinating its scientific expertise, and I've already alluded to this. So since October 2020, for example, the European Union has hosted meetings of its scientific advisors happening every couple of weeks. So the European Union did well on that, not in the early stages of the pandemic, but as things went on. The European Union did very well in encouraging and enabling the full use of legal flexibilities. And here there are a number of examples. For instance, the European Union removed rules on state aids to industry and eased rules on public procurement in response to the pandemic. The European Union made technical standards for PPE, such as face masks, available freely very early on. The European Union actually permitted, on a temporary basis, some non-CE marked products onto the market to deal with the need to secure product supply. And the European Union paused its excessive deficit procedure in autumn 2020. So when it came to encouraging or enabling legal flexibilities, the European Union did well with that. Penultimately, the European Union did well in coordinating the sharing of medical capacity, especially in established border regions, where border regions share a hospital. And there are a number of these Euregio regions across the European Union. They've been in place for a while, and they worked very well in the context of the pandemic. And then finally, and this is something that we might want to discuss because it depends a little bit on whether you're a person who thinks about the glass being half full or half empty, I think the European Union is doing quite well in terms of providing shared financial support to combat the pandemic and to aid recovery, and using this soft power to steer good practice when it comes to the economies emerging from the constraints of the pandemic. So some of the examples here include the RESC-EU packages, which financed medical equipment relatively early on, the European Union using its own resources measures to set up the European Recovery Instrument, which is used in part for what's called SURE funding, support to mitigate unemployment risks in an emergency. And I know that Czechia agreed its SURE package with the European Union, I think in July of this year, and that was signed off at that point. And the European Union also refocused its existing cohesion funds. So the European Union, I think, did quite well in terms of providing shared financial support, but I'm conscious that this is something that people might disagree on. So just very briefly to conclude, in terms of the European Union's response to the COVID-19 pandemic, I think it depends a bit on your comparative frame. So should we compare the European Union to a state? Well, it's implicit in this panel that we should not. The European Union is an international organization. Is the European Union limited as an international organization in the health and law and policy space? Yes, it is. And one of the important limitations of the European Union that I think should be revisited in the European Union's conference on its future is the constrained competencies of the European Union in health law and policy and what that means for institutional structures and path dependencies. So the European Union's constrained competencies in health mean that the wrong people are in the room when the European Union makes decisions that have to do with health policy broadly. And I think a lot of that goes a long way to explaining some of the areas where the European Union did less well. I think a refocusing around a true European health union would be a way to make sure that the European Union is in a better place to respond when the next health crisis, for sure there will be one, when the next health crisis comes along and the European Union has to respond to that. Thank you very much, colleagues.
Thank you so much. That was super interesting. And now we are moving to the last, but not definitely least, speaker joining online, Pedro Villarreal. So you have the floor. Thanks so much.
Thank you very much. I hope you can hear me well. I'd like to extend my gratitude to Federica Cristani and all the organizers at the Institute of International Relations Prague for the kind invitation to join you today. And unfortunately, I couldn't join you in person, rather only online, but I'm glad that at least the technologies of today allow us to exchange our ideas. And so I would follow Professor Hervey's analysis and bring it on to the international level, where many of the assumptions or many of the premises of Professor Hervey's analysis are actually applicable to an even larger extent at the international level, referring to international institutions, and namely the World Health Organization, which is the organization I will focus on today. Since, as Professor Hervey indicates, even the European Union being a supranational institution, in the sense that it has, a robust legal framework in comparison to other institutions beyond the state, its laws have supremacy and direct effect according to the jurisprudence of the European Court of Justice. And still in the field of health, competences are relatively constrained in terms of what it can do. So in the case of the WHO, this claim can be even multiplied in terms of how constrained, actually, from a legal perspective, the competences are to act in the face of a pandemic. I mean by this that we have 194 member states of the World Health Organization, with a wide diversity of economic and political power, with a wide diversity of interests and perspectives on, for instance, the use of rules to respond to these type of health crises. So whenever we discuss assessments such as, how well did the WHO or other international institutions for that matter do in facing an extraordinary event such as the COVID-19 pandemic, we need to, of course, going back to the claim that it all depends on the standpoint, and it all depends on whether we see the glass as half full or half empty. But ultimately, in comparison to other to supranational institutions like the European Union, and for sure in comparison to national authorities, ultimately the WHO is constrained to the extent that it is what member states make of it. And this is where we can identify already several structural challenges or problems that preceded the pandemic and which we saw manifested quite visibly during the pandemic. As I fully agree with Director Pech's assessment that indeed, so it is a challenge for the international community to face events deemed to be of low risk but high impact, events that we do not know when exactly they will occur, but we know that they might occur. And therefore, they do not receive the priority that we would have hoped for once those events occur. As the saying goes, if everything is a priority, nothing is a priority. And before the pandemic, this saying, unfortunately, was business as usual for the WHO, where it was suffering from chronic underfunding, based mostly on the fact that its budget is mostly dependent on voluntary contributions instead of assessed contributions, namely that contributions to the budget of the WHO, more than 85% before the COVID-19 pandemic, was made through voluntary practically donations by both member states and non-state actors like the Bill and Melinda Gates Foundation, a nonprofit organization. And this, of course, constrained the organization, limits its own decision-making capacity, because this dependence on voluntary contributions means it is striving to please the donors instead of setting its own priorities independently. In an ideal setting and under a standard international institutional law, one would expect that an international organization's budget would be more stable and dependent on the membership itself of states. That the fact that states are members of an organization would lead to obligations to contribute a certain amount of money to the budget. But this instead has led in previous decades to a reduced budget under assessed or obligatory contributions and a growth of the voluntary contributions. So this again was a structural shortcoming that preceded the pandemic. And this is what led to the WHO indeed being quite limited in terms of what it could do. And this is also coupled with the fact that, as Director Broža was referring to, the legal framework itself also gives the WHO a certain amount of powers that do not allow it really to take over full control of the global response to a pandemic. And we can refer indeed to the international health regulations, which allow the WHO to declare a public health emergency of international concern and to issue recommendations, that means non-binding advice to states. And as Director Broža referred to, indeed, the declaration of an emergency itself was delayed for a week at least. And this was both due to the emergency committee, so the committee that decides whether we are facing an emergency or not, its own hesitancy of labeling it as an emergency, coupled with the fact that the Chinese government at the moment had provided what the committee thought to be insufficient information of the exact nature of the threat, the virus that was spreading in Wuhan by then, in January 2020. And this, of course, brings me once again to the point made by Professor Hervey, that in the WHO facing its own member states can only do so much. And as the Independent Panel for Pandemic Preparedness and Response referred to, indeed, although the WHO raised the alert and declared the emergency on the 30th of January, it could not oblige member states to act in a certain way. It does not have the legal powers to do so. And this is actually an explicit decision going back all the way back to the founding of the organization itself in 1948, where it was openly discarded that the WHO would act in any way as a supranational organization. So even in comparison to the European Union, the WHO, by design, is prevented from having the same type of reach and scope in its legal powers. So this, again, determines to a large extent what it could do now to face a global threat such as COVID-19. Now, in terms of what went wrong within the organization, and indeed here, it all depends on journalistic information and other reports that have been published, it seems that the personnel, indeed, maybe due to the fact that their legal tools are quite limited, decided to take quite a restrained and diplomatic approach towards countries that were not actively collaborating. And this led to let's say, a slowed down response that could have otherwise given. And this is based on an idea of collaboration where it's better if a member state collaborates, because otherwise the WHO will not have the legal tools to force them or to oblige them to act in a certain manner. So from one perspective, it would make sense, but from the other perspective, of course, this leads to an impasse where what is needed is not undertaken because their member states simply refuse to collaborate to the extent the WHO would require them to do. And so lastly, before I give the floor, so coming back to the point that Federica Cristani also touched upon at the beginning. So indeed, in the middle of the pandemic, and again, back to Director Pech's point, so in the middle of the pandemic, once it became clear that we needed a global response and it was the only way out, several strategies were designed, and one notable strategy was and is the COVAX initiative, designed to distribute life-saving vaccines initially to all countries. So it was designed as a procurement tool for all countries, but due to the fact that the higher income countries, and this includes those of the European Union, decided to procure vaccines separately, COVAX de facto became a tool with which countries with lower purchasing power would receive most of their doses of the vaccines against COVID-19. So indeed, the WHO, alongside other actors like Gavi, the Vaccines Alliance, and the Coalition for Epidemic Preparedness Innovations, a Norwegian NGO, and UNICEF, they devised the COVAX initiative, which to date, indeed, it has fallen short of its own projected estimates. It has distributed a bit around 310 million doses of vaccines against COVID-19, if I'm not mistaken, under the latest data, which is, again, far more than what these countries would have received otherwise. But ultimately, it fell short of, it already revised its original estimates of the 2 billion doses worldwide that it would distribute by the end of this year. And this was, of course, due to the active decision by multiple member states not to use COVAX on the one hand, and on the other hand, going back to Director Pech's point, the fact that there were unforeseen events such as the restriction of exports from its main provider, the Serum Institute in India, which the COVAX initiative was dependent upon to a large extent. And this, again, led the COVAX initiative to revise its own estimates. This, of course, is an unfortunate development, but again, we can only wonder how could it have been otherwise when there isn't sufficient active political will by member states to use the mechanism in the way in which it was envisaged. So this is one of the main obstacles that we have yet to find an answer for. And so I leave it at that, and I leave it to the discussion. I'll be looking forward to questions and debate. Thank you.
Thanks so much, Pedro. That was really great for this first round of speeches. So before giving the floor to the Q&A, just taking the position moderator to ask a couple of questions. So for a very short round, and then we move to the Q&A. From all these talks, I think many things have come up. One question that I think came to my mind is most of you have talked about the responses to the crisis. I was wondering how do you see that it's the time to intervene for the crisis, when the crisis begins, actually, when you see that it's time to intervene, it's about and when it's time to intervene for a crisis, or when it's time instead to intervene to prevent a crisis. So where do you see the signals that you have to intervene? Do you think that other states and international organizations should intervene in this? And also linking also to the issue of cooperation among states, also within international organizations. A lot has been debated how to improve also cooperation, and we've seen We have seen, especially at the beginning, there was more unilateralism and unilateral action were prevailing among multilateralism. And how do you see that this can be overcome to prevent another situation of this kind for the, hopefully not, but in case there will be another crisis, how to be more efficient, to be immediately cooperative among states? And in this line, do you think this idea that has been put forward and also be endorsed by the Council of the European Union of a new international treaty to respond to the pandemic would be a good thing, would be something not really so useful, and how do you see it? And with that, I will give back the floor, then starting again from Mr. Pech. Thank you so much.
Thank you for the floor. On the question of when does a crisis become a crisis and when do we have to start reacting to it, I mean, that is the million-dollar question, because, of course, whenever a crisis is developing or it's about to break out or it's already in its early stages and either states or international organizations have not yet taken the concrete steps to stop it, there are always a million factors in play. There are factors of the economy, of policy. There are always factors regarding the internal workings of a state or an organization. Is the state currently in the middle of planning for an election? Is the end of an institutional cycle approaching? So there are always a million factors that contribute to essentially assessing whether what is happening either internally or externally is or has the hallmarks of a developing or ongoing crisis. So in that sense, it becomes incredibly hard to, and it has already been mentioned by my colleagues at the panel today, to essentially separate what is a developing a risk from what is a standard risk that somehow will blow over and will not impact the everyday structures and lives of people and businesses. So in that sense, it becomes very hard to pick apart the exact moment when to act, which is not, of course, to say that there aren't signs and that there aren't signs that should be followed. And I think one of the biggest takeaways from the COVID-19 pandemic for both member states of the EU and the EU as a whole has to be a increased focus on listening or looking for those signs and reacting to them in real time, and not sort of pushing back and thinking it is something that's only going to blow over, and also to think globally in terms of what is going on, because looking back at the tail end of 2019, there have been signs, and there have been very clear signs that something is happening. We've seen the reports coming out of China, we've seen the reports coming out of Southeast Asia, and we were perhaps a bit lost in our own fantasy of something of COVID being something that is happening far away, and which is not necessarily impacting us. And of course, if we had taken those early signs perhaps more seriously as a not merely as the EU, but as the sort of global society that we live in, more could have been done to prevent the spread and to prevent the escalation of the pandemic and to essentially prevent the last 2 years. Now, of course, always looking back, hindsight is 20/20. You always, have lots of great ideas after the fact on how to tackle something that is developing and something that's going on, and it is, of course, always a matter of prioritization for whatever the powers may be that are deciding on these matters. On the EU, of course, on the EU side, we of course were at a very critical point in the institutional cycle. We were just, at the beginning of what is essentially the new composition of the institutions. So it was also a political challenge for the EU in terms of how to react, how to respond correctly and accurately, and how to deal with these effects. So I think my overall point is that if we have a takeaway from the COVID-19 pandemic, it has to be that we have to react globally to issues that are showing signs of being global issues early on, and not remaining in our beliefs that developing issues on the other side of the world will remain developing issues at the other side of the world. We need to take more care and more effort to communicate and to coordinate with our global partners, and essentially not to take our own positions and our own securities for granted. Thank you.
Thank you so much. So, Mr. Broža, thank you.
Thank you. And I'll start with a reference of my colleague, Mr. Pech. He referred to, several times, listening to science, just a very fresh thing that the Nobel Prize for Physics today was given to scientists, climate scientists, for their ability to explain the complexity of the climate system. So I think that this is excellent news. At the same time, and sorry to maybe shifting a little bit towards different issue, but I think that there is a lot of things to which brings them together: the pandemics and also the climate crisis. Because I've been involved with the climate crisis for a very long time, and I'm saying that prevention is always better than intervention. And seeing, what's happening in that area, sure, we should be listening to science, and science is telling us to act already now. So the question about, when to intervene and when to prevent, as I said, prevention is always far less expensive than intervention. For the international organizations, the intervention is always, there's the issue of the limited mandates and powers. And I think one of the important things which the independent panel I mentioned in my remarks suggests is the more independence, more powers for the WHO. So quite the contrary, which was called to in spring 2020, that the WHO should, and it's not only the WHO, it's the international institutions like the UN, including the EU, although on a different level, to make them more action-oriented, including the panel, for example, suggests that the office of the head of the WHO would be changed from, now the 5-year mandate, which can, with a re-election possible. Now they're suggesting 7-year mandate, only one. That means that, he or she is quite confident that she doesn't have to think, whether the countries would re-elect them or not. So a longer, more powerful mandate for the head of the WHO. And only one thing about the new treaty, which I believe also the pandemic treaty, which is a very important issue. It's not a European level, it's a global level. And the WHO is actually tasked to come up with, the framework for this new framework treaty. And the November special World Health Assembly will be dealing with only one item, and that's preparing the global framework for preparedness for the pandemics. Thank you.
Thanks so much.
Thank you for these very rich and thought-provoking questions. I'll just add 2 further thoughts to the excellent thoughts of my colleagues here. When does a crisis begin? Or when should we frame something as a crisis in political or legal responses? I agree with my colleague. A crisis is when the basic fabric of daily social and economic life is about to break down. So work to prevent crisis then needs to be analysis, and here is where the academy can work closely with government and policy actors and third sector actors also. Work to prevent crisis is analysis of daily social and economic life and its resilience or its lack of resilience. So we're thinking about one of the learning lessons which we haven't yet mentioned on this panel about global supply chains. So, analysis and reflection on global exploitation actually told us in advance of the pandemic that global supply chains were insufficiently resilient to respond to the pandemic. So that would be one example, I think. Is a new treaty to respond to a pandemic a good thing? Well, I'm a law professor, so I guess I really need to say, well, yes. Law is a powerful tool. Law is a powerful tool, especially, and I'm hoping this continues to be true, in European cultural contexts. It's not necessarily as powerful a tool in other cultural contexts. So we need to be, on a global level, we need to be attentive to the way that law is understood or framed when we're thinking about a new treaty. So I think a legal instrument would allow some slower paced and reflective thinking to happen so that when we have to react fast, we can deploy that more reflective thinking, that slower paced thinking. And I also think that depending on its terms, a legal instrument might allow a different balance between political considerations and scientific considerations in responding to another crisis, not necessarily a health crisis, any kind of crisis. So when you get decision-making that's driven by politics, and this was reflected in my colleague's comment just now in terms of the mandate for the head of WHO, thinking that's reflected in politics or that's driven by politics is not necessarily optimal thinking compared to thinking that's driven by science. Now, when I'm saying that, of course, I'm aware that science and politics are not actually separate concepts or constructs, and that there is a deep involvement of politics in the very construction of science, particularly Western constructed science. So I'm making this point sound very simple, but it's actually not as simple as what I'm trying to say.
Thank you so much. And now also to Pedro. Thank you.
Thank you, and I will also follow up on all of my colleagues' comments. Indeed, just to pick up on the last point on a potential new legal instrument that will be discussed in November, either in the way of a treaty, which was proposed by the European Union, or a different legal instrument as was advocated by the United States of America and other countries. Indeed, I guess it will come down to the question of what can we actually do with legal norms, with international law norms, in order to help us be better prepared. What are states willing to accept in such a new legal instrument? And I do believe indeed that there will be so many different interests possibly playing against one another. But I fully agree with Professor Hervey when she says, well, this is a debate that is long overdue, or such a high-level debate and a serious and a very open debate amongst all countries and other stakeholders, not just government representatives, on really what is it that we will need to do as an international community to prevent the response that we currently saw, which was fragmented. It was divided across national lines. So will there be a consensus in the sense that we can agree on a set of common interests and measures in response? That remains to be seen. It is a tall order, considering, again, it is 194 different member states, but of course, I fully agree that the sole fact that there will be such a discussion is already a necessary development. And so following up on the comments by both directors, Pech and Broja, on this crisis rationale, and so how can we agree on a collective and a global vision of what constitutes a crisis, when and what type of responses are needed that are, let's say, not responses available in quote-unquote ordinary times. So, two things that come to mind. First is, as Director Broža mentioned, so do we take the scientific evidence seriously enough as a global community? And in order to realize that, we need although I fully agree with Professor Hervey that science is not and fully isolated from politics in its own development, as we know from the different ways in which science is developed. But, however, we do have at least sufficient evidence to act on other crises, which may be even more devastating than this pandemic. We know about climate change. We have scientific evidence dating back to several decades, and still we are so far unable to create sufficient consensus on stronger measures to combat it. And maybe the pandemic, a new legal instrument on pandemic response, will be subjected to the same stalemate, hopefully not. But that brings me to the second point, before I give again the floor, which is indeed, so even though we may have scientific data, although it's not fully 100% mathematically precise, but we do have sufficient volume of scientific evidence telling us of these dangers. And the other issue is, well, can we then agree as an international community to see that some of the decision-making power to other institutions? Because let us, remembering on Director Pech's claim that, so we need to think globally, indeed, but if we look at the current response, so there was at a certain moment when it came to sharing scarce resources like COVID-19 vaccines at the beginning, what we saw was a pressure on political leaders and national authorities by their own constituencies, by their own borders, by their own inhabitants, to prioritize them instead of the population of other countries. And this goes back to the current system of political accountability that we have in the world, which is heavily national-based. So how can we then deal with global challenges when the current political system is indeed still mostly national-oriented? Because this is the current system in democracies, for instance. This is the current system of electoral laws. And so I see then this challenge that we need to indeed think globally, but we still have these national-based systems of political accountability. And so the trick will be how to navigate these two poles when devising the future global responses to the main threats that we as a mankind face. Thank you. I'll leave it at that.
Thank you so much. Thank you so much to our speakers. And now I see that we have already some questions on the Slido. So I suggest that we open this last 20 minutes, the Q&A session. So since I see also on Slido, but I wanted to share between Slido and the audience, I would like to ask you if there are some questions also from the audience here. I see 2 questions. So I suggest that I take the first 2 on Slido and the first 2 on audience, and then we go for a short round and then the second round. So from Slido, the first one, is there a way to convince EU member states into a health union in a non-political way as to avoid populist concerns about national sovereignty? And the second one, how successful was the EU response at fighting, for example, Polish anti-abortion law and Hungarian anti-gay propaganda passed while the world was busy with the pandemic? That was the second one. Now I'd like to give the floor to our audience. Please, if you can also introduce briefly yourself. Thank you so much.
Well, let me introduce myself, and let me apologize at the beginning that I would like, and not that I would not pose the question that much, but I would like to thank a lot, because we have heard a lot on the response on global level, and we have heard on the response on a supranational level, and I would like to get here also the regional perspective, so the regional level. My name is Irena Krasnicka. I represent the largest regional security organization with 57 participating states, stretching from Vancouver to Vladivostok. I think that you already know that this is the Organization on Security and Cooperation in Europe. And I'm head of the OSCE Documentation Center in Prague. And as we have wonderful archives, I really invite you to work in these archives. And as an OSCE official, I can hardly interfere with the policies of the participating states. But this doesn't prevent me of reminding the audience about the potentially useful tools which this organization has for a building of trust and contributing to lower level of insecurity and also building resilience in the area, OSCE area. And I must say that the OSCE have already tried to contribute to more, I would say, to better response to the pandemics in the OSCE area. It is also limited. We've heard about the limitation of the European Union. We have heard about the limitation on the UN level, and we are also limited by the participating states and by the, I would say, lower enthusiasm for multilateral solutions. And I think that this is the thing which can unify all what we heard today. I must say that it is a bit weird when we think of it from the perspective of people, that the global challenge was not faced on global level, and by even the instruments we have not used it as or participating states or member states have not used those. But I must say that, and this is also a question for our speakers, that I believe that the tools we've got may be used in post-pandemic time. And I believe that, for example, OSCE, with its comprehensive model of security, which has also both security, hard security, economic, environmental, and also the human dimension, is quite well suited for such a response. So that is a moment I wanted also to take into consideration, that we have not only the level, the global level and supranational level, we have regional level, but we all face the lack of trust among the states, participating states or member states, and the lack of faith in multilateralism, even though only multilateral tools can solve the global threats. So sorry, and you can react, of course.
Thank you so much. I will take also the other question, please. Thank you.
Good afternoon. My name is Michael Kaplan. I'm working for the Foreign Ministry here in Prague, but recently I also worked in Geneva as a focal point of Czechia with the relations with WHO. So I was able to observe the UN response to the COVID pandemic from the first hand, but not only observe, but also to influence. And this is very important to know, because it's very easy to criticize international organizations, but we should not forget that international organizations are only a reflection of member states and the global community. So I have three observations. One is to Pedro, who mentioned the COVAX facility as a success and as a joint success of Gavi, WHO, and other partners. But I see a slight difference between these entities, because there were some parts of the UN system which were more agile, more flexible, able to really respond quickly, like Gavi, because Gavi is run more as a private entity. It has a CEO, it has a board of governors, it is responsible to investors, to people who gave money to Gavi. As opposed to WHO, which is more an intergovernmental organization, more bureaucratic, it is responsible to member states. But it is not the member states who gave money to WHO. It is taxpayers in those member states who gave money through their governments to WHO. So there is this double accountability, and maybe this is a problem, and this is one lesson which we should draw from this, how to improve this accountability of the UN entities to taxpayers in member states. And this brings me to the second observation, which is, I agree with Michal, who said that this was not the first pandemic, but it was the first pandemic which happened in the internet age. And I remember that WHO organized press conferences every day, every second day, just to stop the flow of gossip and misinformation on the internet and social networks. But it was not able to stop it. And sometimes even WHO contributed to this confusion, like the misleading recommendations about wearing masks. And I agree that ideally, this recommendation from the UN agency, technical agency, should be based on science, but also some political and other, goals came into this, because WHO knew that masks were effective in protecting people, but they were afraid that they would, if they gave this public recommendation, it would create, shortage of masks, and it would not be enough masks for health personnel, especially in developing countries. So different, goals and interests came into this, and it's really difficult to observe scientific recommendations in this very, stressful situation. And the last observation is to Tamara's, because Tamara spoke more about the EU, and I agree with you that EU was relatively successful and it did well, but more for its own citizens rather than for the global community, because sometimes the regulatory strengths of the EU is good for the EU citizens, but could be an obstacle for a more assertive role of the EU in more globally. And there are two examples. One is this COVID certificate, digital certificate, which is good because it was developed for the EU, but it is also it is a failure of WHO, because let's be frank, WHO as a global organization should have created these standards for global digital certificates a month ago. We raised it in Geneva a year ago, but there was not enough will, to really create this, so that these QR codes would be, compatible globally, and regardless whether you were vaccinated in Mexico or Vietnam or a European country, these QR codes would be compatible and globally recognized. So it is a failure of WHO, but at the same time it is a missed opportunity for the EU, because the EU could have pushed for this and could, this European digital certificate actually could have become a global standard. I know now that it is used by Switzerland and countries in Western Balkans, maybe some neighbors like Ukraine and Turkey, but still there is this gap. And the last example is that the European Medical Agency has more, let's say, rigid and strict standards for approving vaccines, as opposed to, for example, WHO standards. So the Chinese vaccines were already approved by WHO, while it will take more time in Brussels, to pass this process. And this gap created a window of opportunity for China. As part of the Chinese vaccine diplomacy, they provided, vaccines to developing countries, vaccines that at the time were already approved by WHO. And of course, the EU also provided a lot of vaccines and shared its vaccines through COVAX and others. But EU should improve its strategic communication and really use this solidarity also as a more pragmatic tool in its relations. Thank you.
Thank you so much. And I'm adding now also the last two questions from Slido, so then we have a final short round of answers from our speakers. So the first question is, The third question is, should be the competencies of some of the international organizations like the WHO be strengthened? And the second, what should be the role of international organizations for equal distribution of vaccines? And with that, I suggest that we start the round of replies, starting from Mr. Pech. Thank you.
Thank you very much for these very interesting questions. I'll try and follow them in the order that they were spoken. Hopefully I'll get around to all of them within my response. So the first one, is there a way to convince EU member states into a health union in a non-political way as to avoid populist concerns about national sovereignty? Well, it would be very hard. Not because people do not see perhaps the benefits of a health union following the past 2 years, but due to the fact that every discussion about the further devolution of competences from member states to the EU is very difficult, very hard, and requires fundamental changes to the constitutional, should we say, makeup of the EU. Now, we've already very briefly touched in the beginning about the fact that currently there is something called the Conference on the Future of Europe, which is ongoing, which is a essentially EU and beyond, also wide consultation on how primarily citizens wish to see Europe going forward. And one of the 9 key topics being discussed there is also health. Citizens, both privately or via specialized meetings of European citizens panels and national citizens panels, working groups, and the plenary will be discussing these issues. And if indeed the reflection on part of the citizens is that there is a need for further work being done in the area of health, and for there to be a more central role for the EU, perhaps also including more competences for the EU in this area, then that might be a outcome of this conference, and then that might serve as enough of an impetus for this to be tackled. At a EU level. Nevertheless, simply bringing up the topic of any sort of transfer of competences from member states to the EU is always very difficult. It is always very painful for some member states and also for some EU institutions, and it is never easy and it is never fast. So in that sense, I do believe that perhaps the fact that we are holding this conference on the future of Europe, that literally anyone can take part in, anyone with access to internet can take part in, and might serve as an impetus for further work to be done here. But I do think there will be a major challenge in convincing all member states to sign up for further devolution of competences. Now, on the second question, if I remember correctly, and I will just look at the Slido app here, how successful was the EU's response at fighting, e.g. the Polish anti-abortion law and Hungary anti-gay propaganda passed while the world was busy with the pandemic? Well, these are topics which are not mutually exclusive. You don't fighting the pandemic and doing work related to the pandemic does not mean you are also not focusing on these very key and very fundamental issues which have taken place over the past couple of years. Now, of course, whenever we speak about these very core values of the EU, stemming from Article 2 of the Treaty on the EU, and the actions of any number of member states, we always, of course, run into the issue of not just law, but also of politics, and the very fine balancing between the policies of member states and the policies of the EU as a whole. Now, the EU has developed over the past couple of years a multitude of legal means of fighting what are real or perceived breaches of the rule of law, including very basic and core principles of the EU. And those have been sometimes more, sometimes less successful, but they have been made, they have been created, and they are being implemented or in the process of being implemented. So I would not say that necessarily these two items on the agenda have passed by and have not been reacted to, but as anything that relates to the broader politics of member states and the sort of idea of the right of member states to self-determinate their own values and their own priorities. This is always a very long debate, which is of a highly political nature, which of course means that we see the sort of means of combating these issues, which deal with the European Court of Justice, oftentimes more useful and more effective than those which are dealt with by other institutions of the EU, where of course the debate is far more political, and of course we then run into the issues of voting and of having qualified majorities or unanimism for proposing some solutions on this level. But I do think that the EU has not been sleeping on these issues. Perhaps it was not quite as straightforward, or perhaps did not necessarily air these issues as much. But the EU has been working on potential issues, including some of the perceived actions by Poland and Hungary. So I do not think that the pandemic has necessarily left these issues on the side. Now, as for the latter two questions on the competences of the international organizations and the role of international organizations for the equal distribution of vaccines, I think those are better served by my colleagues from international organizations. So I will leave those for them.
Thank you really so much. So, Mr. Broža, please.
Thank you very much. No way be able to respond to everything, but I'll just take some of the moments which I find good. Thank you, our colleague from OECD, to reminding the importance of multilateralism. And I think this is also a matter of education as well, to bring this idea to all levels of political and also civic understanding of the importance. And let me maybe just say what Immanuel Kant already in the 18th century said, and I believe that's the essence of multilateralism, is because sometimes we are calling for the powers to have something like a world government to make the decisions. We don't have that, and we will not have that. But Kant said we do not need a world government. What is needed is democratic nations committed to human rights and the rule of law, cooperating for shared ends. That's as simple as it is. And thank you also to my colleague Michal Kaplan for his insights from within the WHO decision-making process. The face masks issue, of course, I remember this pretty well. But I would rather comment on the COVID global pass, and that's rather my personal observation than knowing from within the WHO. I'm not part of that organization, but the WHO, of course, belongs to the UN system. But what is important now to say, we have at the moment countries like Portugal with 84, I think, % of population vaccinated. We have Chile, more than 70%. We have Israel, more than 60%. We have Czech Republic, nearly 60% of people being vaccinated. But we have countries in Africa, for example, there were less than 2% people were vaccinated. And it's the reality of, a big part of the world. And again, the division between the North and South is happening at the moment. So this may be the priority on the global level, to rather bring first the vaccines and then. So that's my only personal comment. And my last very short comment, Slido, whether the WHO to be strengthened, and yes, definitely. I think that if we want to have more able international system, then we need stronger international institutions by by the essence that we trust that these institutions would help us. Thank you.
Thank you so much. Since we are starting to run a bit out of time, but I wanted to give the floor also to our last two speakers. So please, Professor Hervey, thank you.
Well, I'm fortunate because my colleagues have already dealt with most of the questions and said some very thought-provoking and useful things, but I would like to thank my colleague Michal Kaplan for his reminder to me that my analysis of the European Union was about the European Union's internal policies. And actually where the European Union did not do very well is in its external policies. And the European Union has been doing not very well in its external health policies for decades. And that's something that I've been following in my research. So there is could do much better place for the conference on the future of Europe to think about. And here, if I may just loop back for a moment to the question about populism, there is a massive education task for us all to do here. Because actually, until people understand how interconnected they are, they will think about their own tiny lived experience, and they will not think about that tiny lived experience as being interconnected with actions that happen elsewhere in the world. And therefore, they will take political action, voting or not voting, accordingly. So there is a longer run project which is about educating people about how the world actually works and how interconnected the world actually is. And that's part of the response that I think is necessary to populism. I could say more, but I won't because we're running out of time and we need to hear from one more colleague.
Thank you so much. And give me the floor to Pedro.
Thank you very much, and also to Professor Hervey for granting again the floor. And I will, of course, echo what she just said on the need to educate and to inform more about the global nature of these challenges, because that will help us overcome this strictly localized and nationally emphasized responses to what is, in essence, a global challenge. Now, I also thank Ms. Krajicka for reminding us of the importance of multilateralism, and I do agree. So that it all comes down to whether there is trust among different states on the value of collaborating, and this will be in their own best interests. And the challenge is indeed how to make the case that this is indeed to everyone's best interests and not just a matter of competition or other geopolitical, national geopolitical considerations. And just as a response to Michal Kaplan's very detailed and very useful question, in the sense that indeed, so what, on the first hand, how to deal with the fact that in the case of COVAX, for instance, it was Gavi, the Vaccines Alliance, a public-private partnership, and not the WHO, the one leading the design. And that indeed is closely related to the fact that the pharmaceutical research and development sector is mostly market-oriented and led by private for-profit actors, and where this is the result of decades and maybe even longer historical developments. So that is why an active decision was made to not only make COVAX, since pharmaceutical innovators couldn't be forced to do X, Y, or Z, since they all hold the patents, how to make it attractive as a business case as well. And in this regard, the WHO was not considered to be the best suited forum for such a strategy, but rather Gavi, the Vaccines Alliance, which with its public-private nature could steer more efficiently such complicated waters of business-related decisions and so on. So, but indeed, in the future, maybe we can think of how to overcome these market-driven considerations that end up sometimes distorting, right, the pharmaceutical research and development at the expense of, as Director Broža unfortunately reminded us, at the expense of those countries with a lower purchasing power. And lastly, So indeed, I do believe the WHO could be strengthened, but we still need, reminding on Michal Kaplan's comment, we still need to deal with this tension between the different interests at stake that exist during a pandemic and the remedies that are needed to face it. And therefore, we do need these high-level debates that will occur in the following months. I will leave it at that, and thanks again, everyone, for your attention.
Thank you so much, and I think this closes perfectly our panel. I'd like firstly to thank really so much our speakers for these great presentations, and I'm sure the discussion will continue again also in the coffee break, so please just join me in thanking our speakers for this.